Does a pap smear test for HPV? Imagine you're getting screened for cervical health and wondering if a pap smear checks for the virus that can cause cancer. The answer is a bit nuanced but important to understand. A pap smear, also called a pap test, does not directly test for human papillomavirus, or HPV. Instead, it looks for abnormal or precancerous changes in the cells of the cervix, which could be caused by an HPV infection. During the test, healthcare providers gently collect cells from the cervix using a small brush or spatula. These cells are then examined under a microscope to identify any changes that might suggest early signs of cervical cancer or other issues. Now, HPV testing is a separate process. It specifically searches for the presence of high-risk HPV types in cervical cells. These high-risk types are known to cause most cases of cervical cancer. HPV testing detects the virus's DNA or RNA within the cells, giving a clear picture of whether a person has an ongoing high-risk infection. This test can be done alone or combined with a pap smear in a process called co-testing. When both tests are done together, they provide a more complete picture of cervical health and help determine the best next steps for management. It's important to understand that, if a pap smear shows abnormal cells, your healthcare provider might recommend an HPV test on the same sample. This helps identify whether a high-risk HPV infection is causing the cell changes. If the HPV test is positive, it indicates a higher risk of developing cervical cancer if the abnormal cells are not monitored or treated. If the HPV test is negative, the abnormal cells might be due to other factors, and follow-up might be different. Both tests are essential tools in cervical cancer screening. The pap smear has been used for decades to catch early cell changes, while HPV testing has become more common because persistent high-risk HPV infection is the main cause of cervical cancer. Combining these tests helps healthcare providers make informed decisions about follow-up care, treatment, or further testing. In the context of reproductive health, understanding the difference between these tests helps ensure early detection and prevention of cervical cancer. It is always best to follow your healthcare provider's advice and screening guidelines, which are tailored to your age, health history, and risk factors. Remember, regular screening and open communication with your doctor are key to maintaining cervical health and catching any issues early before they develop into more serious problems. So, to sum up, a pap smear does not test for HPV directly but looks for cell changes caused by the virus, while an HPV test specifically detects the virus itself. When used together, they provide the most thorough screening to help protect your reproductive health.